we are the only hospital. We are going to run full. The only emergency room in the whole island is on 7 Point Finger Road. And
That is correct.
that is something that when we visit other hospitals, they wonder how we deal with that. Because emergency rooms, for example, in the U.S. can close. Okay, we're full, go to the hospital down the street.
They can divert.
We do not have that
Luxury.
So we can have a full emergency room and full wards.
Yes.
So you see that's the case. Meanwhile, someone's having a road traffic accident. Almost use the terminology there. Acronym there. Road traffic accident, and on the way in for ambulance to a full emergency room and not a ward for them to go to. So my point is that when we set discharge dates and times, it's not a luxury. People very quickly move out of hotels. We know that the discharge time for a hotel is 11 a.m. and rather we have to put our suitcases out in the hall and sit in the lobby, we get out of the room by 11 a.m. We don't expect to be a Hilton. These are sick people, these are patients, but as we set discharge dates and times, we need the public to know that it's because we need that bed for your relative, your fellow Bermudian resident or whoever who's either in the emergency room needing to come up to a bed, in the operating room having recovered from surgery needing to come up to a bed, or in the ICU needing to come up.
Okay, somebody comes in for surgery today, so they show up at whatever their designated time is. They have their surgical procedure, and then they go up to the ward.
Right.
Now,
And we have to have had our planning so tight that we know, preferably the day before, what bed that patient is going to go into. And that's based on Beverley Howell, who's been discharged, leaving that bed before 11 a.m. so that we can prepare that bed for Johnny Doe, who's coming up, having had his surgery, having come in as the same day admission.
I'm just letting you know I ain't coming in.
Okay.
Because
I knew you would appreciate that.
And I'm not coming. But
Yeah.
I understand what you're saying.
Yeah.
So, and we sometimes, like, so if somebody gets the Dawn and PACU, the peri anesthesia post-operative care unit, if they're down there and they can't get up to the ward, what has happened? Why can't they get up to that ward?
Okay. There's not a bed available.
And it's not available because of what? Because discharge time is 11
The
o'clock.
planned discharge has not left. They've either decided. Remember, the situation that is acceptable is that patient is not well enough to be discharged. We do not discharge people that are unwell.
Yes, and that's
Okay.
let's
So
get
if
that
something's
clear.
happened overnight and that patient cannot leave, that patient cannot leave. That is their bed.
Right.
Okay. But if all is going well and the person has said, well, I can't leave now. I need to have my lunch, and I don't see why my daughter should leave her job and come and pick me up for 11, and she'll come at 4.
Right. My daughter doesn't get off until 5, and then she's got to go pick up her children, and then she's going to go have her supper, and then she's going to come at 8 o'clock to pick us up.
These are the things you hear in the evening.
Right.
Right. So that may seem reasonable to the person, and I understand that, but what we're trying to show you today is how that blocks things up. We've now got to look for another bed that doesn't exist for that patient to come out of the OR. Meanwhile, 2 patients have come into emergency probably too that need admission beds, so they sit down in our system with no bed. That's what we call them.
And then we have somebody, there's a bad road traffic accident, and we have to get somebody into ICU, and ICU needs to move up past.
The only way ICU can take that patient is if we move out one to the ward. So there we've got 4 patients vying for this one bed, and that's something we have to live with if it's because of the patient's situation. But we shouldn't live with that because the person that is occupying that bed now really needn't be in it.